Okay, so we are starting the adult physical exam, and we'll get started. So today this is a patient with initials LS. She goes by Linda. She is a 55-year-old female with here just for a well physical, and we took her weight earlier. It was 115 pounds, and she is about 5 feet 5.5 inches in height, so BMI of about 19, which is still within normal limits. So we'll go ahead and get some vital signs. How are you feeling today, Linda?
Good, actually.
Good. Did you have a nice holiday?
I did.
All right.
I did. Still recovering, but it was nice.
All right. It's been a while since I've done a manual blood pressure. Okay, a little squeeze.
I usually run low, so.
112 over 68, which is normal and unconcerning. Feel for your pulse here. Okay, about 80. And respirations look to be about 16 breaths per minute. So starting from, we'll just kind of move from head to toe with the physical here. I'm looking at her head to make sure it's symmetrical. It looks to be so. I don't see any asymmetry. I'll have you puff out your cheeks for me. Like that. Great. And then squint your face in. Good. I'm going to try to open your eyes. Keep squinching your face. Good. And so she's got that muscle tone there that is symmetrical. Looking at her hair, there is no patchiness. There is, it's not too thin or too coarse. I'll look and feel the scalp here. I'm not feeling any abnormalities at all. I'll have you, I'm going to place my hand here, and I want you to turn your chin towards my hand against resistance. Yep. Push, push, push. Good. And again. And the other way. Good. So she's got that muscle strength there. I'll look at her eyes here, and having her look at me, I notice that her eyes, her pupils are symmetrical. They're both facing forward. Her eyelashes are well distributed. There's no lid abnormality. She's got her lacrimal glands are normal and symmetrical. There's no drainage. There's no inflammation. There's no swelling. Her sclera are white. There's no increased redness. And again, no swelling. At this point, I can check her pupil reaction. So just go ahead and stare. You can look at my nose. Just going to check. Good. And I'm getting reaction from both pupils. I can then look into and look for the red reflex in the back of her eye. So just, yep, you can stare at my nose again. I'm getting the red reflex. And I can see the vasculature in her eye. I can see the optic disc margins. Okay, good. And I'll do the other eye. There doesn't look to be any inflammation. I've got my red reflex. And again, the vasculature looks great. I'll test those cranial nerves of the eye. So follow my finger looking in, testing for accommodation here. Good, and her pupils move equally. Again, stare at my finger and follow it wherever it goes. Good. All right, moving on to the ears. Again, I'll look for symmetry and inspect for any drainage to see where they're attached on both sides, making sure they look equal. I can then palpate to notice if there's any pain at all, or redness, swelling, anything in the back, and everything looks normal. At this point, I can go ahead and inspect. Alright, so I'm going to look in your ear. So I'm pulling the ear up and out and going in, looking in the ear canal. I see the tympanic membrane and it looks normal. I've got my light reflex and that looks no redness, no draining, no earwax buildup. Again, pulling the ear up and back. Sorry. And again, the tympanic membrane is white, opaque with that light reflex coming back at me. So no drainage there. The ears are within normal limits. I can look at the nose moving forward. It is symmetrical. There isn't any abnormality there. I don't notice her sniffing her nose or any drainage at that point. So I will just look at the up and just see, yeah, no obstructions, no sinus abnormality in the nose there. Have you had any troubles with sinuses at all, or?
Never.
No?
Never. I woke up with a little sore throat this morning, but
okay.
no sinus issues.
Nothing other than that. Okay. So I can just kind of palpate sinuses here. Tender at all?
Mm-mm.
Any pain in here?
No.
Great. Again, being thorough, you can just, nice and still, and illuminate the sinus there. And they don't seem to be any problem. So I can move on to the mouth. Looking at her lips, I don't notice any cracks. I don't notice any drainage again. Her mouth is symmetrical. So I'll have you actually open your mouth and look in the back, looking at the soft palate and hard palate. If you can say ah. Very good. And I see a raised soft palate. Okay, and you can stick your tongue out. All right, good. No abnormalities. Everything looks normal there. Okay, you can relax. And just show me your teeth for a moment. Good. Looking at gums. Looking at making sure she has all of her teeth. She looks like she's got great dental care. Testing your tongue, I'll have you say the letter D, T, N, L.
D, T, N, L.
Okay, very good. So meaning that her nerves are intact orally. I will then look at her neck and move on to the neck. Again, she's holding her head up properly. She's not leaning to one side more than the other. So I'll have you can you shake your head no? Good, and shake your head yes. This is proving she's got good range of motion and she has ability to flex her neck. I'm looking for any abnormalities with limps or anything asymmetrical there. I don't see anything here, so I can move on to my palpation exam. Starting behind the ears, I'm palpating the lymph nodes, coming forward, underneath the jaw, not noticing anything, and nothing here. And I can do supraclavicular as well. Good. Everything feels within normal limits. Stepping behind the patient, I can assess for her thyroid. So I can feel my landmarks here and have you swallow. Great. And that feels, I can assess. My computer went dark. There we go. And everything feels normal there. I'll test your gag reflex and have you take a sip of your coffee or water,
Okay.
either way. Go ahead and this is assessing. Good. Yep, that her gag reflex is intact. All right. Moving on to our respiratory assessment. As she's sitting here, I'm noticing if she's in distress breathing, her efforts of breathing. She looks like she's breathing without any issue at all. From my visual assessments and inspection, it looks to be symmetrical. I can assess that once I move on to my palpation part of the exam. So I don't see any distress. At this point, again, I can assess for, the supraclavicular lymphs. If you were to I can assess for the axial lymph nodes here. Moving my hands in a circular motion. I'm not feeling any lumps or bumps. You can do that again on this side here. And no changes. I can then, part of the exam, it went black again. Oh, sorry. Okay. So what you can do is when you're assessing for resonance, you can percuss in between the intercostal space. Each intercostal space looking for resonance. And you wouldn't want to do it on the bone because then it's kind of hard to do right through that chart, but just for privacy issues. But that is one way to assess the lungs. At this point, I can assess her breathing. And so I'll go ahead and do that now. I'm going to assess your trachea first. And I'll just have you take a couple deep breaths because part of the neck exam is listening for bruits in the neck as well. So just hold your breath here. Great. Okay, and relax and breathe. And just another nice deep breath in. Good, and again. Good, very clear. So I'll start on the right lung. Breathe big inhale. Good, and move to the left to assess symmetry. Good, moving to the left lower lobe. Good, and the right middle lobe. And the right lower lobe. Good. Those sound symmetrical. I'll move on to the back sides of her lung sounds, starting with the right upper lobe and the left upper lobe. Moving to the right middle lobe. Moving to the left lower lobe. And the right middle lobe. Good. Part of the respiratory exam that also is included is looking at skin color and noticing if there's any cyanosis that would indicate any trouble with circulation, looking at clubbing of nails or anything like that. Moving on to the cardiac portion of the exam. We can again inspect color of skin to assess for cyanosis, any edema, swelling, or anything like that that would indicate a cardiac abnormality. Inspecting the heart, I can again feel for pulses. And that would assess for circulation. She's got good regular beats. And what I can do is palpate for a heart rate. I'll just point out where the landmarks are. So the apex would be at the fifth intercostal space, mid-clavicular, left clavicular, the middle part of that. And then moving forward, another place to palpate would be the fifth intercostal space on the left side of the xiphoid process. Then the second clavicular space, intercostal space on the left side of the sternum, and then the second intercostal space on the right side of the sternum. Would be all areas to assess the heart. To palpate, you can, and then as well as epigastric here on the patient, feeling for any abnormalities. So I'll just go ahead and listen in those areas. Good. And I'm hearing a regular heartbeat, a normal S1 and S2, no murmurs, no abnormalities. Okay, I will also feel for peripheral pulses, so I'll have you slip your shoes off if that's okay. I don't know if that can be seen, but
Sure.
Yeah, whatever. Right there, yeah, that's fine. Perfect. Okay, so feeling for the pedal pulses. Great. They're both +2, as were her wrists. There's that one. You can feel for tibial here. One's always a little harder. Okay. Sure. Great. So, at this point we can assess the GI-GU part of the exam, looking at abdomen. So I'll actually have you lay down if you don't mind. Sorry. So I will be looking at the patient's abdomen, looking for any irregularities, any abnormal contour. I don't see any at all. Then I can start from the right lower quadrants, just light palpation, noting for any masses or bumps. Everything feels normal. For rebone tenderness, I can press firmly and release. Any pain?
Nope.
Great. To assess for the spleen, I can stick my hand underneath the spleen and kind of feel this one is a little harder, but noting its outer edges. And same with the liver. Our setup is a little bit different, but you're okay. I would support the liver and kind of feel for that. You can also percuss those organs as well. You can relax. Then I can listen, starting in the right lower quadrant at the ileocecal valve. She's got positive bowel sounds moving up this ascending colon, across the transverse, and into the sigmoid. Great. She's got positive bowel sounds in all 4 quadrants. It is important to note that you are postmenopausal, correct?
Correct.
Yes. So as part of that assessment. So moving forward, we can continue with our assessment. And my dog's eating the cotton balls. Hey, Lexi. Okay. Get up. Get up. All right, so I will have you, actually, you can stand if you don't mind.
Okay.
And I am assessing her posture. Even when she didn't change her posture to stand forward, she is not leaning to one side or the other. And she's holding herself up fine. I will have you maybe walk towards me and then walk back towards the wall over there. Good. Looking at, her gait, which looks great. I'll also have you stand against this wall here. And I'll adjust the camera accordingly. Yep. So I'm looking for lordosis. If you can press the lower part of your back against the wall. Good. I can't fit my hand behind there. Okay. Walking, and then I'll have you take your heel, your right heel, and bring it up your left shin. Good. And then opposite, put your, yes, exactly. So she's got her balance there. Okay, you can walk forward again and sit on the bed is fine. So I can then, she's got good muscle tone. I should probably turn it back. Yeah. All right. So I will assess joints and range of motion. So I can feel the back of your jaw, open and close your jaw. Good. She's got good range of motion there. We looked at her neck earlier in the exam, but you can shake your head no and yes. So she's got good movement there. Her shoulders, I'll have you take your right hand and put it behind your head, and then your left arm and put it behind your back, proving that she's got good range of motion with her shoulders. And let's do opposite. So left hand behind, exactly. Very good. Good. All right. I'll have you stand again, and I'll actually have you face this wall here. I'll have you flex forward, so bend forward. Sorry, all the way. And what I actually...
Computer's up.
Oh. And what I'll have you do is, what I'm looking for here is scoliosis as well. Yep. So, and then you can come back up towards me. Good. And she's got good flexion there, so I can assess her joints. Are you able to bend your knee into a 90-degree angle? Good. And circle it out. Good. So she's got good range of motion there, and back in. Good. And the same with the left. Yep. Good. Out and in. Good. Go ahead and take a seat. I'll have you move your ankle in tiny little circles. We're assessing for her foot. And then the left side. So she's got good strength there. I'll have you lay back if you don't mind. Assessing muscle tone. Can you raise your legs against resistance? So let's do one at a time. So raise your right leg. And don't let me push it down. Good. She's pushing against me. Raise your left leg. Don't let me push it down. Good. Okay, relax. And then flex your toes to your nose. All the way, your entire foot. Good. And don't let me. Good, good, good. And then press down on my hands like a gas pedal. Good. Okay, go ahead and sit up again. I apologize for all of the up and down. I'll have you grab my hands. You're fine. And squeeze. Good. And then pull. Don't let me pull you. Don't let me pull you. Good. And I'll test your shoulder strength as well. This is part of the cranial nerve assessment. Raise your shoulders and don't let me push them down. Good. She's got good shoulder strength there. Just making sure I'm assessing every single part of your musculoskeletal system. I think we've covered all of our bases. So moving on to the neurologic part of the exam, we had already tested for the accommodation and we tested for your ocular movements. We did test for the your ability for your neck to move and your strength there. Your hypoglossal nerve with the ability to move your tongue. We'll just kind of do a quick run through of the neuro exam, just to make sure we cover every piece of the exam. So minus the accommodation and the ocular movements. So let me know when you can see my fingers.
Dan?
Okay, great. And this side?
Mm-hmm.
Great. All right. And can you hear this?
Yes.
Can you hear this?
Yes.
All right. Does it sound the same on both sides?
Mm-hmm.
Great. Can you... Make sure it's not the one. Let's see. Feel this?
Yes.
All right. Do you feel this?
Yes.
Do you feel the same on both sides?
Yes.
Great. All right. And can you tell me what year it is?
2016.
Very good. So assessing for, we were having a normal conversation about the holidays earlier. I can tell that her memory is intact. And she's having normal coverage. She's, following my cues. She's doing what I tell her to do. Mentally, her memory seems intact. She seems appropriate for the situation. All right. So I'm just going to do a few sensory tests with you. So let me know. I'll have you close your eyes and you can just let me know if you feel what I'm, when I'm touching you.
Yep.
Okay?
Yes.
Okay.
Yep.
Great.
Mm-hmm.
Okay. And then, so that was the light touch, and then I can do the painful stimuli.
Yes.
Okay.
Yes.
Good.
Yep.
Okay. Good. Awesome. I can then have her tell me where I'm touching her. So close your eyes again.
Right arm.
Yep.
Left shin.
Good.
Right thigh.
Yep.
Left hand.
Good. And then I will introduce a stimuli and she can point to where I touch her. Good. So this
Are my eyes closed?
Yeah, your eyes are closed. Sorry. Good. Okay, very good. Now I will have you. I'll look at your hands here, and I'm looking at her joints, and her hand joints can move just fine. So I'm going to move one of your fingers, and you can tell me which way I'm moving it.
Up, down,
Okay.
sideways, left sideways,
Good. I know this is
up, down, right, left.
very good. All right. I will then have you keep your eyes closed still, and you can flip your palms over. Again, assessing range of motion in her joints. And I'm going to draw a number in your hand. Tell me what number I'm drawing.
3. 4.
Very good. I will also now have you identify a common familiar object. Feel that around, and what does it feel like?
Paperclip.
Yep. Good. And then the other hand.
Pencil.
Very good. You can relax. And then what we can do is do the 2-point testing so we can see when she senses when the 2 become 1. So on your finger, I'll just borrow your right hand. I want you to tell me do you feel 2 stimuli here?
Yes.
Okay, I want you to tell me when you start to feel 1.
Getting close.
Yep. Okay.
1.
Okay, so her sensory nerves are intact. Go ahead and open your eyes. Good. All right. Overall part of the exam is looking at skin as well, making sure there's no rashes, any skin irregularities, being very thorough in that way. I don't see any edema in her legs or in her toes. She seems to be, her integumentary system seems to be completely intact. Overall, a general assessment is that my patient is in great health. Her vital signs are within normal limits. She is within her accepted limit of a BMI percentile, and she exhibits good mobility and strong review systems. So overall, I would say she's in great health, and to follow up again with a year. Part of another, full physical visit would be to draw labs and assess from there as well. So, any other questions or concerns you have today, Linda?
No, thank you.
You're welcome.